As you think about how Medicare covers your healthcare needs when you turn 65 or are joining Medicare for the first time, your first major decision should be whether you want to enroll in federally run Original Medicare with a Medigap plan versus a Medicare Advantage plan, which essentially replaces your Medicare benefits with a private run insurance plan. Hi, I'm Rick Teska, founder and licensed Medigap advisor here at Senior Market Solutions. If you haven't already, please click the subscribe button and click the bell to enable notifications. Stay tuned as we discuss Original Medicare with a Medigap plan versus a Medicare Advantage plan. So once you've decided that you want more coverage than Original Medicare alone, you will need to figure out which of the many insurance options will best fit your needs and budget. In general, you can either opt for Original Medicare and supplement it with a Medigap plan, or you can choose a Medicare Advantage plan, which replaces your Original Medicare. So let's start by looking at the differences between Original Medicare with a Medigap plan versus a Medicare Advantage plan. Medigap plans help pay for what Medicare does not, like the various Medicare deductibles, co-insurances, and co-payments. Depending on where you live and when you become eligible for Medicare, you have up to 10 different Medigap plans to choose from. Each plan is labeled with a letter from A through N and includes different set of benefits. The three most popular plans being Plan F, Plan G, and Plan N. Since these plans are federally standardized, a Medigap Plan G from one company is exactly the same as a Medigap Plan G from another company. Medigap plans in Wisconsin, Massachusetts, and Minnesota have different names, and you can find out more about these plans on this YouTube channel or our website. For the rest of you folks, each lettered Medigap plan offers a different set of benefits, but all plans with the same letter must offer the same benefits regardless of the company you buy it from. A Medicare Advantage plan replaces your Medicare coverage. All your benefits are then handled by the Advantage plan company. They wrap everything all in one policy. It includes the basic benefits of Original Medicare, but the coverage comes with, in some cases, significant out-of-pocket costs. Medicare Advantage plans may require that you see healthcare providers in their network and/or that you get a referral from your doctor before seeing specialists. Each plan has different rules, costs, and restrictions, and those can and do change from year to year. In these plans, you will not be able to fall back on Medicare because you gave those benefits up when enrolling into the Medicare Advantage program. If you sign up for Original Medicare and a Medigap or Medicare supplement and later decide you'd like to try a Medicare Advantage plan or vice versa, be aware there are certain enrollment periods when you are allowed to make those changes. Additionally, Medigap enrollment rules vary by state. Look at your state's rules before disenrolling from your Medigap policy. Once you leave your Medigap plan, it may be hard, if not impossible, to get it back. Keep in mind that different areas have different Medicare Advantage plans and Medigap options. A particular plan may not be available where you live and could vary drastically in what benefits are covered and what costs you pay out of pocket. For assistance finding a Medicare plan that works for you, our advisors offer free consultations with straightforward, honest Medicare advice and answers. A comparison of Medigap plans versus Medicare Advantage plans can easily illustrate the pros and cons of each plan and how that might affect your health care. It is important to examine all the differences carefully before making a decision. Once a person has chosen between Medigap and Medicare Advantage, enrollment with one of our advisors is both fast and friendly. Use the link in the description below to schedule your free consultation with one of our expert licensed advisors today.